Hello, this is Dr. Gay from First Lake MRI, and this is a patient who has a dorsal ganglion cyst of the wrist. This is the wrist here looking from the side view, the sagittal view. This is the back of the wrist or the dorsal side, and we see a bright, well-defined fluid collection here. This is a classic dorsal ganglion cyst of the wrist. So the surgeon is going to go in there and remove this. And this is the back of the wrist. This is towards the palm here. This line here is the slice. Represents the slice right here. If we go down, we can go into the distal forearm. This is the radius. And now here into the mid-wrist, and we see that dorsal ganglion cyst. Now the surgeon asked about another fluid collection. He was worried there was another ganglion cyst in the palmar side, the opposite side, right over here. So we do see a little lobulated septated fluid collection right there. If we go to the sagittal or side view, we do see a little fluid collection right here. We see a little blip of fluid there, so he's worried that maybe there's another one over here on the radial side, and of course a bigger one here on the dorsal side. The patient did not have any symptoms here on the palmar side. So this is something that I can't find in the literature, but I've seen it in practice many times. There's a little area, I imagine, of weakness here, and it allows for joint fluid to prolapse through, and patients can get a little fluid collection here along the palmar aspect of the distal radius. So anytime I see a little septated fluid collection here, I've learned not to even mention it because I don't believe they're a ganglion cyst. I think it's just a little prolapse of joint fluid since it's so common. And this is the classic ganglion cyst. So I looked at several cases, I think 10 MRIs of the wrist before this one, and looked to see if I could find anything that looked similar to show the surgeon that this may be a normal little fluid collection rather than a pathologic one. So here's one of the cases. So this is an arthrogram where we filled the joint up with contrast, which is white here. So if there is any prolapse of fluid that's bulging outwards, it should show up on this pretty good. If we go towards the palmar aspect, this is over the distal radius. We do see a little fluid collection right here. I'll put up an axial view here. See this better? And here we go. This is the axial view. This is the distal radius. And right here, sure enough, there's a little collection of contrast. If we didn't have the fluid in the joint that is bright, filled with contrast, this would just look like a little fluid collection. And I think some people would call this a little ganglion cyst, just like we have in this case. So this is proof right here that normally fluid can protrude out through a little weakness in the distal radius, over the distal radius through the joint capsule, and hang out right here. And it comes down sometimes over the distal radius. This is an area of caution. If you see a little fluid collection here, it may not be a ganglion cyst. It may just be prolapse of joint fluid. So I'm going to look at some more examples of this. Again, here's the radius, ulna. This is a tear of the triangular fiber cartilage and probably a palmar radial ulnar ligament, and it's allowing for contrast to extravasate over here abnormally. And this, again, is the area where there's a little weakness in the joint capsule, and the contrast is just bulging out over here. This is another patient with a very subtle fluid collection. This is the radius. This is along the palmar aspect here, and there's a little tiny fluid collection right there. The radiologist had called this a ganglion cyst, I think mistakenly, but a little fluid collection there, probably the same thing where the fluid is protruding through a subtle defect in the joint capsule. This is not a very good example though. Here there is another example where the patient had contrast in the joint. So if there's prolapse of fluid, it'll show up a lot better. And there it is, same little contrast collection over the palmar distal radius, a little weakness in the joint capsule, a little fluid poking out here, and look, it goes out and down. Here's another patient, a little fluid right there, and here's the fluid on the palmar aspect right there that goes out and down a little bit. Here's the next patient. We do see the same little thing, the radius, little tiny collection of fluid there protruding through a small defect. And here it is on the sagittal view, little fluid collection. Now one more patient, and this patient again has the arthrogram, so the fluid is very bright in the joint. As we go over the distal radius, here's the radius, and there's that little contrast collecting over the palmar distal radius, protruding outward. So it looks like when it's under pressure, especially with an arthrogram, that weakness allows the contrast to bulge outwards. We see it here bulging outwards, and some of it may even have extravasated down here. So again, this looks like a defect that we've seen in almost half the patients, and more evident when they've had an arthrogram to have the joint capsule protrude outwards. And so again, if we see fluid collection, a fluid collection here, rather than calling it a ganglion cyst like it happens very often, we should call it a probable prolapse of joint fluid, a little developmental defect of the joint capsule. And that's it. Thank you very much.